So, Professor Marie Tassignon, could you explain in simple terms what the bag-in-the-lens technique is and how it differs from traditional methods of cataract surgery?
Yes, well, it is a short question, but it is difficult to answer it in a couple of minutes and a couple of sentences, but I will try. The bag-in-the-lens has the big advantage that it is surgeon-controlled centration. So it proves the centration of a lens. So if you want to implant a complex optics with the bag-in-the-lens, you can center it based on the visual axis of the patient. It is not dependent on the capsular bag. It sequesters the lens epithelial cells in the periphery of the capsular bag, so there is no PCO at all, provided you can really implant the lens properly, implanting anterior, posterior capsule in the lens groove, and then you have the solution. So you have no PCO, you have centration options, and you have a clear vision normally for the rest of your life.
Thank you. So the second question, can you share any specific examples of how patients have benefited from the bag-in-the-lens technique?
Yes, well, this is an interesting question because indeed some lenses, for example, lenses with a very weak patients with a very weak zonule, they cannot benefit of traditional lens implantation technique. There is another technique that has to be used. There are different techniques, but for example, the bagging technique is still possible to use in those patients because you have bean-shaped rings at additive devices that can be used in order to center the lens. The advantage is that you know where you are, that the principal lens position of the intraocular lens is secured, which is not always the case when you use an artisan lens or a scleral fixated lens. Then, in addition, when you have very small eyes with very small capsular bags, you can still implant an intraocular lens because the total width of that lens is only 7.5 millimeters.
Thank you. The third question, what should a patient expect during and after a bag-in-the-lens procedure in terms of recovery and potential improvements in vision?
Yeah, well, I think it will be quite similar regarding the recovery. However, there might be a little benefit, but we never did a comparative study. But I think that there is even a potential benefit between both techniques in favor of the bag-in-the-lens because the lens epithelial cells are sequestered in the capsular bag, so they cannot react on the cytokines that are liberated due to the stress of the surgery. So potentially you expect to have a decreased inflammatory response in the anterior segment after primary bag-in-the-lens implantation technique.
So thank you. We wait to. Are there any specific patient conditions or circumstances where you would particularly recommend the bag-in-the-lens technique?
Well, in fact, yeah, everybody is a little bit afraid in operating patients, for example, with diabetes. We have studied that, and the diabetes patients, they do not do any inflammatory reaction, so that is quite an advantage. It can be implanted as well in patients with uveitis, for example, difficult cases even, because it will never cause synechia. And that is also very important in patients who have the inherent tendency to develop inflammatory reaction and synechia by the iris. So that is certainly very, very important. And of course, a very big area, which is the pediatric cataract surgery, that gives a tremendous advantage in children because the number of reoperations due to posterior capsular opacification or whatever is tremendously decreased, dramatically decreased.
Thank you. And the last question, what kind of follow-up care or adjustment are typically needed after a bag-in-the-lens procedure?
Yeah, the regimen of medication that are necessary for the follow-up of the patients is a little bit lower than in the traditional cataract surgery. You only need 4 times per day corticosteroids combined with antibiotics, anti-inflammatory drug medication, and that's it. I think that it is overdone, but it is always it's always better to be at the safe side and to treat it. Even for children, we never use a traditional recommended regimen by the ITS by giving them 6 times a day. It's 4 times a day a drop is much more enough. We will increase the treatment regimen with corticosteroids in children where you have iris issues, where you have iris degeneration or whatever. Then we increase the regimen to 6 times per day for the first week. We observe very carefully the reaction. If necessary, and if possible, we decrease immediately as soon as possible. So for us, 1 week treatment regimen of corticosteroids, even in children, is enough.
Thank you.